There's a huge burden of oral disease. The most frequent untreated infection in humanity is dental caries and periodontal disease. These oral infections are really rampant in our population. The increase in these diseases is enormous, not only in the United States but globally. And yet the demand for dental services is actually down. Well, how do we handle this paradox? The reason is that dental care is expensive. The average American today, according to Money Magazine, over 60% of Americans, if they were asked to come up with $2,500 this week to take care of a medical emergency, could not do so. And yet we do have medical insurance that covers that. Dental insurance, of course, even when one has it, doesn't cover $2,500. It typically covers $1,000 maximum. So we need to reduce the unit cost of care to increase access to care to populations who cannot otherwise get that care. The way to do that is to look at the workforce. Dental therapists are oral health professionals. They're amazing people. We've been educating them now in our 5th year. So our goal is to have one educational standard and one practice standard. Quality is not measured by who is delivering the care. Quality has an intrinsic measure. So we educate our dental therapy students side by side with those other oral health professionals that are learning the same knowledge and skills. We find our patients in our clinics with dental therapy students are very, very happy with the dental therapy students because, in part, the dental therapy students are very interactive, very focused on prevention, and very focused on the sets of procedures that their patients need. If I sat around the table with 10 dentists, I've rarely met the dentist who would say, darn it, I wish we hadn't started that dental hygiene thing. Dental hygiene's bad for my practice. Well, dental hygiene is for periodontal disease, exactly what dental therapy is for dental caries. And we know there is a decline in demand for dental services right now, but the reason is cost. I talked to a friend who was in practice in St. Paul, in an indigent community in St. Paul, who closed his doors. And he closed his doors because he said, all that I could do all day was to try to treat decayed teeth, to fill the holes all day long. And I did it till I was exhausted. And when I was done, I had $280 to show in profit. And I just couldn't stand to do it anymore. And I said to him, you closed that office 3 years ago. What if you had a dental therapist to work side by side with? Would you have kept that office open? And he said to me, because he had been opposed to dental therapy, and he said, no, looking back today, I think I'd have kept that office open. The idea that there are many people now embracing dental therapy as a new and exciting idea to improve the oral health of the public, yes, but also to improve dental practice and to improve the chance to get dental care to more patients, to build more, not only good oral health, but to create more demand for dental services. These are the things that the dental profession is now becoming aware of.